apart, don't stand too close, you gon' fuck around and drown. Off this way, doing all these shows. I've been on the road, I don't care where I go, as long as I get paid. Bad luck.
An overextended spine, also called the open scissor fault, is one of the most common squat problems. This is often due to a poor understanding for how to properly brace your core when you set up your squat. Many are taught to pull their stomach in to activate the transverse abdominis, but this is wrong. If you think about your core muscles like guy wires that hold up a radio tower, drawing in decreases the base of foundation these muscles can create, therefore less spine stability. First, get into a neutral spine posture. This means ribs stacked on top of your pelvis. Then you're going to brace your core in a way that expands your stomach slightly laterally. This concept is tough for many, so practice this frequently with your hands into your stomach. A proper brace pushes them to the side. This is how you're going to brace your core before every squat you perform. So again, align your ribs and pelvis, proper breathing and bracing, then start your squat.
Okay, so there's a few things I'd like to share about that. First of all, this is anatomically very, very incorrect. My name's Paul Check. I'm the guy that developed the whole concept of the core. If you don't realize that, I've been lecturing on the core since 1988, and my courses are chock-a-block with very comprehensive explanations of the anatomy, physiology, and everything related to scientific core conditioning and core control. So there's a few things wrong. That example that he gave of a guy wire, it's not anything nearly that simple. So let me take you through a few things here to point this out. One, the deepest layer of the abdominal wall is the transverse abdominis, and it works particularly with the posterior fibers of the internal oblique. It wraps around your core and your organs. So think of where your belly button is, that's where the action center is. So the transverse abdominis comes around and it supports your organs like a corset. The difference though is that the transverse abdominis fascia merges in with the fascia of the latissimus dorsi and the posterior fibers of the internal oblique. And there's a crisscrossing mechanism so that the fibers of the fascia attach like that and like that as a crisscross, hard to do. The effect though that when you draw your belly button in, which you should not have to consciously do, I will get back to that, as soon as you lift anything heavy, your brain automatically turns your transverse abdominis on, because when it contracts, remember it wraps around these organs like a corset. So as it's pulling in, it goes around to the back and it puts tension on the fascia, and the fascia is constructed and the fibers are aligned in such a way that it actually has a lengthening effect. It extends the spine. It does not flex the spine. First, you have to stiffen the system in order to have a working foundation for the large muscles he's talking about to work on. So you have core stabilizers and prime movers. What he's talking about is activating prime mover muscles, and if you don't have normal core activation for the deep abdominal wall, that will not only just compress the spine, but it encourages shear forces through the spine. The other thing is that the diaphragm, the deep abdominal wall, the transverse abdominis, which is the deepest layer here, the posterior fibers of the internal oblique, which run down in behind, below your lats, down right back in here, the pelvic floor. So the pelvic floor, diaphragm, deep abdominal wall, and deep spine stabilizers are all on a reflex loop. So for example, if you put your finger in your belly button, and for a man, if you just lift your testicles using your cremaster muscles, just think of lifting your testicles, you'll feel your belly button pulling. If a woman does a Kegel, draws her pubococcygeus muscles or vagina up and in, it'll fire those muscles. If you tighten your rectum like you're stopping a poop, you'll feel your belly button move in. If someone even loads your arm, if your body's working correctly, your core will contract because it has to stiffen the spinal system, where we have to look at what's called segmental stability. The approach he's taking creates gross stability, but if you do not have a fully functional inner unit, which is the muscles I just mentioned, and you load your spine, you might be able to hold the load, but on the inside you can have vertebrae that are getting excessive compression, torsion, and shear, which are the three enemies of spinal joints and lead to a lot of spinal pathology. And I have rehabilitated thousands of people and the very best athletes in the world, many of them making exactly that kind of mistake. And that strange maneuver, the lateral contraction of the abdominal wall, is a very hard thing to do, and it's not a natural thing to do. Nothing I'm talking about here is unnatural. One of the problems is that your internal organs all share reflex connection with the abdominal muscles that surround them and surrounding muscles in the body. So if you have any inflammation in any of your internal organs, it will reflexively inhibit your prime mover muscles and your abdominal wall, because the abdominal wall has to expand to make room for the swollen organ. And every woman who's been premenstrual knows her lower abdomen distends because there's a reflex shutting that muscle down, decreasing the tone so that the uterus can expand. If it did not have that ability, if the abdominal wall tension stayed too high, it would keep the uterus or any other organ that expands due to inflammation under pressure, which would radically reduce circulation, decrease blood supply, decrease nutrient delivery, and decrease waste removal, and therefore seriously slow healing. So the system's actually designed to work beautifully without you having to think or do anything. The problem is that so many people have dysfunctional spines from sitting too much, being dehydrated, exercising incorrectly, unresolved injuries, inflammation in glands and organs due to bad diet, toxins in food, and many other factors. So as I've shown for a very long time, all the way back in the very beginning when I started my scientific core conditioning and scientific back training programs in the early 90s and mid 90s, it's because people have to be re-educated, just like you have to learn a new movement pattern if you have a faulty movement pattern, that we have to go through a series of tests that test each of these core muscles for their function. Once we isolate those muscles that aren't working properly, and we do dietary changes, and we do the right mobilizations of the spine and joints that are necessarily involved, and we get the diet cleaned out, and we use isolation exercises to specifically target any of the muscles that are not working, all of which I show you how to do these tests and corrections in my scientific core conditioning course that's coming up in a week. You can see the information below. If you want to sign up, there's about a week left. But once you isolate, rehabilitate through the right use of exercise mobilizations and diet changes, integrate, and then go back to the gym, you only use the core activation to draw in, just to train the system how to do its normal sequencing again. Once you're doing it right and the system learns, as long as you aren't traumatizing it or inflaming your body again, it runs automatically, or we would have never survived in the wild. The problem today is so many people have unresolved injuries and a lot of inflammatory agents and toxins in their diet, and a number of other factors that are too long to get into here that run all the way up through the spine, the cranial nerves, and everything that can be causing problems down here, that we have to go through the proper stages of evaluation, correction, integration, and then you can go back to normal training. But I would tell you, as someone with a lot of experience, 40 years of experience, and a lot of study of anatomy and physiology, and many times in surgical centers watching athletes getting surgically evaluated and corrected for a myriad of different things. I've studied this. I've done EMG studies. I've done 5 cadaver dissections. I know this system inside out and backwards. It's far better to learn how to do it right. A lot of these 10-second little clips that make you sound like people are geniuses and give you all this magical stuff are very misleading. So I'm happy to show you how to do it right. I've probably got the most comprehensive education in this area in the world anywhere. Over 40 universities last time I checked were using my programs to educate people in kinesiology training, physiotherapy training, chiropractic, osteopathic, and other training programs. Why? Because they work and it's accurate. So I'm glad you're learning little things, but sometimes you have to figure out what's wrong before you can be led to what's right. I'm just fortunate that my assistant brought this to my attention so that I can keep you from getting lost and confused. And I'm sure the man's intentions are good, but there must be a million different articles and videos that are totally wrong and misleading, and I hate seeing people get misled. So if you want to learn to do it right, I'm here to help you. My senior instructor, Matt Wallden, who's a naturopathic and osteopathic physician, will be assisting me, and I'd love to teach you how to do it right so you look good, feel good, train good, and get the results you want and minimize any risk of injury and learn how to rehabilitate common injuries. So thanks for joining me. I'm Paul Chek.